Good afternoon. Welcome to IS3. My name is Dr. Geraldine Inocencio-Diaz, and I'm a practicing OBGYN at Kaiser Permanente San Bernardino Medical Center. My practice focus is in minimally invasive gynecologic surgery, and I will be your phase 2 facilitator for this school year. My preferred pronouns are she, her, and hers. And a fun fact about me is that I have a golden doodle named Kono, who is 3 years old, but has not grown out of chewing my house slippers when I leave home. So why don't we take this time to introduce ourselves to the group and share a fun fact about yourself. Thank you for that. In phase 1, there was an emphasis on learning biomedical science fundamentals with an introduction on how these fundamentals affect medical conditions. In phase 2, the emphasis will shift to understanding the development, identification, and treatment of medical conditions, supplemented by the fundamentals learned in phase 1. More emphasis will be placed on the natural history of the disease and the socioeconomic factors which influence their development and management, utilizing fundamentals to understand how the disease spreads and the pharmacologic management of these medical conditions. So our learning objectives are 1, to utilize our knowledge of biomedical sciences to determine presentation, progression of disease, and our select initial treatment in common clinical presentations. We want to also integrate knowledge of the biomedical and our health system science to describe the rationale and interpretation of diagnostic tests in moderately complex cases. We want to recognize the potential long-term sequelae of common chronic medical conditions, taking into account the natural history of the disease, risk factors, adherence, and the socioeconomic status. This is a pass-fail course. Honors are not awarded. 5% of your grade is based on attendance. You will receive credit for excused absences. 35% of your grade is based on class participation. 5% of your grade is based on your learning project. And 60% of your grade is based on 4 subject matter exams administered quarterly. This is a case-based discussion course similar to phase 1. You will be provided materials to review ahead of each class and expected to know and understand the material prior to the case-based discussions in order to be able to have a robust discussion on the cases. I'm available by email or appointment to review any material which you may have trouble understanding. Please allow at least 1 business day for me to respond to your emails. We encourage open and respectful discourse. If there is a subject matter which you may be uncomfortable discussing, please let me know ahead of time and we can make arrangements as needed. My ask is that we all keep an open mind and be respectful of each other's opinion, even if they differ from ours. I encourage open dialogue. If I display behavior which may be off-putting, please let me know, and I encourage you to be open and honest in as kind a manner as possible with one another as well. Does anyone have any questions or would like clarification on any of the points discussed so far? Very well. We will begin with our first case today. In today's discussion, our objective is to apply our knowledge of embryology, field development, and mechanisms of teratogenicity, which you learned in phase 1, to explain the etiology and progression in our complications that can be encountered during pregnancy. Let's divide ourselves into 2 groups. You will review each of the cases amongst the members of your group, and then bring your answers to the class. So our first case is Ms. Gupta. She's a 35-year-old G3P1 who is being interviewed on the phone for her first initial visit around 6 weeks after her last menstrual period. She is very excited to be pregnant, and she is ready to answer all the prenatal questions. So what I would like you to do is to now break up into your groups and choose which groups you're going to be in. If you have a preference whether to be referred to as Group A or Group B, let me know. Or if you want to name your group, that's totally acceptable as well. What I'd like you to do for this first activity is to think about what questions you're going to ask Ms. Gupta to elicit her symptoms, her physical symptoms, and any changes she may be noticing on her body, any changes she may be noticing with regards to cravings or aversion to certain foods. So I'll give you 5 minutes to do that and then report on your discussion. Which group would like to go first? Okay, Group B. So I see that you have nausea, good. Breast enlargement, tenderness, good. Hyperpigmentation, good. Abdominal bloating, good. Increased weight gain, good. Cravings for pineapple and certain foods, good. So our next group, would you like to add anything to that? Perfect. Increase urinary frequency, and you would do a home pregnancy test. Great. So the next question is, what does a home pregnancy test measure? What are the hormones produced that the pregnancy test measures? Good. It measures HCG. Now I'd like you to go over the biomedical basis. How does the home pregnancy test work? What is it looking for? Perfect. It's an antibody test that is looking for the HCG. Good job. So now we have additional history from our chart review. The patient reports her weight is 123 pounds. She's 5'2". She has no past medical history. She did have a laparoscopic appendectomy at age 22. Her mother has diabetes on insulin. She's taking prenatal vitamins. She has no known drug allergies. Her vaccinations are current, including MMR, varicella, COVID, and flu. She does not smoke, drink, or take any recreational drugs. She has no diet restrictions. She prepares her own meals at home, eats 2 to 3 servings of fruits and vegetables daily. She is not a vegetarian nor a vegan. With regards to her OB history, she has had a previous pregnancy that resulted in vaginal delivery of a 7-pound male 3 years ago, followed by a spontaneous complete miscarriage at 7 weeks later. GYN history, she's had negative pap smears in HPV 3 years ago. Pap in HPV done last year was negative as well. She's in a monogamous sexual relationship with her husband. She lives at home with her husband and son. She works as a freelance writer. Respond negatively to intimate partner violence and depression screen. Patient states she is Jewish of Sephardic ancestry. What labs and surveys would you order at this time? What nutritional advice, weight advice, and vitamin supplements are recommended? What teratogens should Ms. Gupta be counseled to avoid? And Ms. Gupta is concerned regarding the miscarriage she had in her last pregnancy. How would you respond to this case? Concern. So discuss this for 10 minutes in your small groups and be prepared to share the recommendations you would make for the patient and your rationale.